Whether you've just brushed and flossed or still have that coming up in your morning routine, we know how important oral health is to people of all ages. Once a month, we'll chat with a dental health professional to get some great tips on how to keep your pearly whites shining bright. Today, we are joined by orthodontics specialist Dr. Paul Puszczak. Welcome.
Good morning. Thank you for having me.
Good morning. The braces, the braces. For many kids, I'm sure they're probably going, oh no. But yes, how many parents out there are probably wondering, when is a good age to bring the kids in, maybe take a look at seeing them getting braces?
A really good age to see an orthodontist for an initial assessment is around about the age of 7 to 8. Most orthodontists won't do a lot of treatment at that time. We'll do an initial assessment, refer back any interceptive treatment to the family dentist, because ultimately if there's some minor things that can be done, it'll lessen the severity of the problem later on. And then once the child embarks on their pubertal growth spurt is usually the time when we'll embark on treatment.
So usually they'll get referred by the family doctor?
In most cases, yes.
Okay. And if a child does need braces, what is the ideal age to have them fitted with them?
Typically, orthodontic problems are dental related to the teeth, and many times are related to the jaws not being aligned properly. We usually treat patients as they embark on the pubertal growth spurt or go through puberty so that we can have an impact and do some orthopedics, manipulation of growth to make sure the jaws are properly aligned, while also then having the permanent teeth erupted so we can make the tooth or dental changes at the same time.
Okay, and funny question, but is there much pain involved with the procedure?
Today it's much better than it's ever been. Years ago, when orthodontics involved a lot of pressures and wires that were very strong and exerted a lot of pressure on the teeth, pain was much greater than it is today. Today the technology has gotten so good that we have high-tech wires that you could tie a knot in and they'll untie themselves. They're heat sensitive, and also we apply very, very gentle forces to the teeth today. So applying the gentlest force over a period of time is the best way to move teeth, and that involves the least amount of pain too.
So how have they changed since the old heavy metal days?
Oh, tremendously. As a matter of fact, I don't even have a set of the old ones to bring in to show you, but years ago we had full metal bands that were cemented to the teeth, and our brackets, orthodontic brackets, really are precise little handles that just give an orthodontist control of that tooth to be able to put it into place. As technology improved, what happened is the adhesives or the bonding materials got so good that we could just bond the tiny brackets to the teeth, so we no longer have metal bands around the teeth.
Okay.
And today that's gotten even better. The brackets, typically the bracket is that little handle. We would lay the wire into the bracket, and then you would tie an elastic.
Oh, I remember the elastics.
Now once you've done that, try to pull the wire out. You can feel the amount of pressure it takes. So each tooth feels that pressure as it gets aligned. Well, today's technology, the biggest innovation in my profession, has been that now we engage the wire, but there's a little door that locks on the bracket. So you can see that
no
there's
friction.
Almost no friction, very little resistance, the least amount of stress and pressure on the teeth.
Wonderful. Well, thank you, Dr. Paul Puszczak, for coming on in and showing us that there's nothing to fear anymore. For more information on oral health, you can call the Alberta Dental Health Association and College at 780-432-1012 or log on to their website, www.abda.ab.ca.